So we are live now. We can go ahead. Sir, we are live now.
With more than 40,000 animal bite victims being vaccinated 100%. The 100% compliance was recorded and no case of adverse reaction was registered. With this, it is my honor to introduce you uh, the today's webinar speaker and chairperson, Dr. Asu Mehta sir. He is a physician practicing in Maldahiya General Hospital and anti-rabies clinic, Maldahiya, Varanasi. And this is very अगर बोले तो बस बनारस का सबसे पुराना और सबसे फेमस वैक्सीनेशन सेंटर तो वेलकम यू डॉक्टर I would like to request Dr. Asumida sir to initiate the talk and later we will have a question answer session also. All the participants can drop their question in the drop box and we will read out all questions after the presentation. So, welcome, doctors. The next session, yours, sir. Please continue, sir. Please, let's continue, sir, with your presentation and additional information with your experience, sir.
Thank you, Ranjit ji. Thank you, Ranjit. I am Dr. Ashwamita. I am from Varanasi. Basically, I am an MBBS physician practicing in Varanasi under a small clinic hospital, Maldaya General Hospital. And our vaccination center is nearly 45 years old. My father, Dr. N.K. Midda, he has started everything and we all are into it. Actually, the experience, what we are gaining, live experience, practical experience is far bigger than the experience what we study in the books. It is a deadly disease uh, because of which many of the patients we have seen, they have lost their lives, and it becomes very difficult for us sometime when we become helpless that we cannot do for the patient anything. I'm audible, I'm clear.
Yes, sir. Well, sir.
Okay. The other thing is today, actually, the Cadla has asked me to just initiate and to have a vast discussion on their new vaccine, that is Thai rabies. That is the first world's first 3-dose vaccine that they have introduced on a pattern that is we known as it is like they are not basically they have made a rabies like particle and they have made a vaccine by that, so the reaction things and other things are very less, so we should just go further with it. Basically, what we are going to see is that the rabies disease, what is the rabies disease, and what about the animal bites incidence in India. We can see the epidemiology and evolution of rabies vaccine challenges, what we used to see in our daily routine, unmet needs, and The best part what we will see is the introducing of Thai rabies, where we can find that they have done some trials also, clinical trials, phase 2, phase 3. And what I have come to know that they are on a another trial where they are trying to use the vaccine on some younger generation and the older people also. Now first come to the rabies disease. As we know, the rabies disease is a very, very, very fatal disease. How and why? As we can see, it is a bullet shaped virus is there, and it is a zoonotic disease. Basically, it is spread by the animals and everything. Basically, what we should, as a practitioner, we should come to in our senses that most of the time we used to say, हाँ डॉग बाइट है, हाँ जी ठीक है डॉग बाइट है, हम उसको जो है आपको उसने कुत्ते ने काटा, खरोंचा, क्या किया. First we should know how we should do the category of the disease. There is basically three categories: the category 1, category 2, and category 3. As we can see, there are many categories, three categories. How we will find out in which category the patient is, we have to put the patient in which category, and how we are going to help the patient, and how we are going to initiate the vaccine schedule for the patient. It was a very basic thing that everyone has studied, that 0, 3, 7, 14, and 28 days is a post prophylaxis dose. And after that, we have seen that there is a pre prophylactic schedule is also there. But as far as we have seen, there are many times we have seen on the 5 dose regimen, because first it was bigger 14 dose regimen, before that it was more bigger. But as we have seen the progress, as we have seen the more and more development it has come in the vaccination and in the uh, vaccination things. So we have seen there is always some new things we are introducing as to reduce the fatality of the patient. We have to inject the vaccine as sooner as the better. As we have seen, now we can see there is a rabies virus is generally found in the saliva of the animals. So those animals, those who are on like stray dogs, wolves, foxes, we have seen in our places that the rat bite has also caused, the squirrel bite has also caused the rabies. So we have to be very, 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 very particular that every zoonotic animal, those who are giving a bite, must get a rabies vaccine first. Because of which we can see the more prevention we will do, the better the result we can find. Now, as we can see, there is a G protein is there, N protein, P protein, MP protein, many RNA, many where we can just hit the this bullet ship virus. We can kill the virus very easily. But the best part is G protein, where they have done a major role, and they have made an antigen in the formation of neutralizing antibody NAB and against rabies virus. Now we can see that globally 59,000 rabies deaths per year we can see. And in India, it is 20,000 rabies deaths and 91 deaths in rural areas. See, rural and urban area, urban people are mostly they are much more aware about the disease. They are much more having circumstances lively, like they have district hospitals, they have near hospitals, they can just go and get the vaccination. But in the rural areas become very, because most of the times people doesn't know that they have to take the vaccine. They are under this thinking that no, we will just count the feet of the dog, we will just count the uh, fingers or something like that of the nails of the dog, and we will see so many drastic different kind of thoughts are there. That is negative thoughts that says you do not require a vaccine. Every individual must get a vaccine so that they should prevent themselves. Now evaluation of the rabies vaccine, what I was talking earlier, that there is a live attenuated vaccine that has been derived from the spinal cord, and it was quite very, very, very sensitive, and it has got very anaphylactic reactions can be seen with this vaccine. As the development has occurred, we have got a 14 injection vaccine. As you can see, it was a brain they used to inject the virus in the animal, and then they used to cultivate it from the brain of the animal. And then we have come with an inactivated vaccine, cell culture vaccine, that everyone is using nowadays. Many of the companies, they have introduced it in India. Most of the companies are doing it, but the basic is 0371428. Is that this is the major point where we are going to talk. Because if you want to cure something, you have to be very quick. Like in prevention also, prevention is better than cure. It is very easy to say, but prevention should be in a smaller, in a precise, and in a very particular manner. See, as therapies, we can see they have introduced the vaccine for just 3 doses, 037. In a week the patient can get the vaccine, and patient can get easily, because there is no reactions. As I have used it in many of the patients are very much happy, because within a week their burden on their mind, that doctor have mentioned that first you have to take on 0, then you have to take third dose on the third day, then on the 7th day, then 14th, then the 28th day. It means many of the people have problem, because if they are going somewhere outside they cannot go, they are bound to take the vaccine, and they are engaged in a cycle where they have mental pressure. That mental pressure has been now taken off by therapies. Cadla has done a wonderful job. Like we can see, the current rabies vaccine are cell culture vaccine, CCV. Inactivated vaccines are 50 years old technology. As everyone knows, this decreased compliance beyond the 3 injection. That what we are talking about. Because of the 5 doses, 3 doses people used to take very easily, but on the fourth and the fifth dose they used to have, sir, I went outside, I couldn't take the dose. What should I do? Should I repeat the course, or should I do something else? What should I do? So this was the query from the patients. So after introducing this, it becomes easy for us also to just help the patient and be very compliant. Sir, these are your doses, 0, 3, and 7. Within a week or so, your dose will be over, and you will be easily able to take the vaccine. Now we can see the non-compliance, the major issue what we are talking about beyond third injection. As you come meeting here, we can see in this novel vaccine, as we can see, thigh rabies has been introduced. This is the first intravascular regimen. The better part is that we do not have to mix the vaccine. It is a recombinant rabies G protein vaccine which is already mixed, and you have to just use it. Just take the vaccine, as simple as any other vaccine. It is a very wonderful process. You have to just inject the vaccine to the patient. The better compliance and convenience, and the best part is easy to use. Within a week, your patient is not going to run, your patient is not going to have a confusion, your patient is not going to be that much burdened by your prescription, that for a month he has to just remain in a certain place, because now it is a very fast moving time. People, they do not have time. We have to conserve their time, we have to cut short their time, the maximum we can do, and give the best results. That we have found here in thyroid, you can see. It is a virus like protein that they have developed, and with that they have made the vaccine, because of which there is an antigenicity and there is no pathogenic property in the vaccine. As the vaccine has been derived from the isolation of the G protein with the VLP technology, which has been purified and stabilized by the Caterpillar Pharmaceutical, just as you can see on the screen. And the rest part is, this vaccine will help the basic needs of the people with a quick response. As we can see, there is an original article, a research article that we can see here, that everyone has given their best to, and APCRI journal has introduced this with the help of Dr. Sumit Poddar, Dr. Ashok Agarwal, Dr. Amit Soni, and Dr. Seema Sharma. And everyone has done the best what they can do. In 2021 it has been introduced, and now we are on a very good regimen. Like we can see that 0, 3, and 7, as you can see, the vaccine doses is wonderful, very wonderful. And in this slide, basically, they have introduced the slide because to see how many days the vaccine can give their results. But see, as we know that when we are using a 5-dose vaccine, we used to say to the patient, see, when there is a dog bite, we have given the patient a vaccine. See, you have to take 5-dose vaccine. Okay, for a month he has taken, and suddenly within 3 month or so, something has happened, and another there is a scratch bite of the patient by a dog or something is there. So what happens? The patient has a query: should I take again the full dose? This gives us, this study gives us the ability to understand that the vaccine, after an introduction, after injecting to the patient, it can give immunity up to 90 days. As you can see, all the titers are 100%, and at 180 degree, 80 day and 270 day, it has reduced little less. So what we can see, that within 90 days, if it is there, then we can give the patient a 3-dose vaccine very easily. Now, what we are finding out in the clinical study, as we can go further, that clinical study has been done, and safety and immunogenicity of the novel 3-dose vaccine, as you can see, clinical study has been done, and it has been expanded to the clinical study third, where we can see that the rabies vaccine has been used to multiple of the subjects, and they have found it very good. And as personally, I can say I have used the vaccine and I am satisfied with them. So the results are good, easy to get to your destination, and easy to find out what the result you can find. What is the our primary objective is there? Our objective is basically to help the society, help the patient as soon as possible. Now, as the slide goes up, there is a result. As you can see, there is a constant across the different age groups and genders. See, the different age group, as per their result and study, what I have studied is that they used to say that within uh, age group of adolescent till the age of 60 years, sir, you can use the vaccine very easily. And now they are using and they are giving a trial in the younger age group, and most probably within a month or two you are going to get the results that they have we can use the vaccine in children also, because it is under study, under trial. So it is very easily injected, easily to find out, and easy to do it. The other thing is Thai rabies has a non-inferior to reference vaccine, less adverse effect compared to the reference vaccine. See, reference vaccine, they are taking a vaccine that has a 5-dose regimen, and because of that, it is a like we have talked about, it is a VLP. VLP is virus like particle, and there is no pathogenic effect is there. But there should is always a chance that we should be always cautious when we are using any of the vaccine, to be ready with our adverse effects. Simple adverse effect, any kind of itching or something is there, we can just see to the patient that we can prescribe any anti-allergic or something, that if it is there, or we can use uh, some anti-allergic medicines also. Novel 3-dose therapies was found to be the safe and immunogenic, and was comparable with 5-dose WHO pre-qualified vaccine. That is the wonderful thing we can see. And these are the awards that we have got. And this is the last slide. After this, it is thank you. Just I want to share my some thoughts, and if possible, I would like to just share it in Hindi also, so that if some of our patients or our some of our viewers, if they want to, they have something they couldn't understand, I will just in a small, I will just explain it in Hindi also. देखिए, हम लोग इस वैक्सीन को बहुत आसानी से यूज कर सकते हैं। इसको 3 चरण में लगा सकते हैं हम लोग, 0, 3 और 7 दिन पे। जिस पे पहले दिन पे हमने पहली वैक्सीन लगानी है, फिर 3 दिन बाद लगानी है, एंड फिर हमें 7 दिन बाद लगानी है। 3 दिन के अंदर हमें पूरा डोज आसानी से हम पेशेंट को लगा सकते हैं। पेशेंट का सबसे पहला सवाल यही होता है, साहब मेरे को ये बताइए कि मेरे को कितने दिन में सब सुइयां लग जाएंगी, मेरे को बाहर जाना है, मेरे को घर में ये है, मेरे को कुछ प्रॉब्लम है, तो भाई 3 दिन में आपको डोज लग रही है, ये हमारा अचीवमेंट है। एज अब आप सोचिए, जैसे जैसे समय बीत रहा है, जैसे जैसे नई नई चीजें आ रही है, वैसे ये हमारा अचीवमेंट है कि हम अचीव कर पा रहे हैं। अब बात आती है हमारे पास कि हमारे जो पेशेंट हैं उनको हम कैटेगरी कैसे, हमने अभी बीच में बात की थी कैटेगरी 1, कैटेगरी 2, कैटेगरी 3। हमें एक दो चीजों पे बहुत ध्यान देना है। कैटेगरी 1 होती है कि अगर स्क्रैच हो जाए, हल्का सा स्क्रैच हो जाए, लेकिन उसमें से कोई भी हमारे को ब्लड या कोई भी सीरम पार्टिकल या कुछ भी ऐसी चीज नहीं दिखती है, बॉडी में फ्लूइड नहीं निकल रहा है, तो दैट विल कम अंडर कैटेगरी 1। इसके बाद आती है कैटेगरी 2। कैटेगरी 2 होती है जिसमें डॉग बाइट हुई लेकिन उसमें स्क्रैच हो गया। स्क्रैच के साथ हमारे साथ ये देखा गया कि हल्का सा ब्लड आ गया, और स्क्रैच भी हमारा जो है ऐसे हुआ कि देखिए जितना ब्रेन के नजदीक होगा उतना रिस्क बढ़ जाएगा। हमारे को वैक्सीन के साथ हमेशा ये याद रखना है कि हमें इम्यूनोग्लोबुलिन्स का यूज जरूर करना है। इम्यूनोग्लोबुलिन्स आज की तारीख में ये है कि वो हमें डे 1 पे ही हमें अगर इंजेक्ट कर देते हैं तो हमारे को बहुत ज़्यादा सेफ हो जाते हैं हम लोग। अब बात आती है कैटेगरी 3 की। कैटेगरी 3 ये होता है कि जब बाइट बहुत ज़्यादा गहरी हो, बहुत ज़्यादा काट लिया डॉगी ने या किसी जानवर ने काट लिया, तो हम लोग उसमें क्या कर सकते हैं? हम लोग उसमें भी सबसे पहले इम्यूनोग्लोबिन का यूज़ करेंगे, फिर उसके बाद हम अपनी वैक्सीन का यूज़ करेंगे। अब हमारे पास ये फायदा है कि हमारे पास मॉनिटरिंग का टाइम है। भाई हमने आज लगा दी वैक्सीन, फिर 3 दिन बाद लगाई, 7 दिन बाद लगाई। अब आप अपने पेशेंट को मॉनिटर कर सकते हैं 7 दिन के अंदर जो है उसके पास क्या है क्या नहीं है। हमारे को इस चीज़ का थोड़ा सा ध्यान रखना है कि कोई भी पेशेंट किसी भी वजह से वैक्सीन ना लगवाए। हमें कोशिश ही करनी है अपने पेशेंट की मदद करें और उनको वैक्सीन लगवाएं, और हम लोग इस देश से, इस समाज से हम लोग रेबीज मुक्त भारत बना सकें। ये मेरी आज की आप लोगों से बात है, और इसके लिए मैं बहुत शुक्रगुजार हूँ। थैंक यू सो मच। थैंक यू कैडला, थैंक यू फॉर such a nice and wonderful webinar. Thank you so much. Any questions, please just ask.
Thank you so much, Doctor. And I request you all the participants. So, if you have any question, please message in Dropbox. Sir, one question is very basic question. Simply, what is the dose of rabies?
Dose of rabies is 0, 3, and 7. 0 day, third day, and 7th day of the bite. 3 dose vaccine and very easy to inject.
And next question is intramuscular or intradermal the mode of injection.
It is an intermuscular injection. You have to just inject the vaccine on the, you can start from the left arm, then you can inject in the left deltoid or the right deltoid, and then left. You can alternate the vaccine intravascularly.
Thank you so much, Doctor. A very common question coming in the box, and we are also facing field also. There is a question if any person got one vaccine or two vaccine and next vaccine will be missed by 1 or 2 days, then what to do?
Within the schedule, if the vaccine first dose and the second dose has been taken on 0 and 3, the patient can miss a day or two, but not more than that. If it is there, then we have to repeat the vaccine for the safer side of the patient.
Thank you so much, sir. And in this question, after checking the hemoglobin result,
With high rabies, hemoglobin is required if it is a category 2 and category 3 bite.
Okay, sir. Thank you so much, sir. I want also and rabies is
Correct. It is an anti-rabies vaccine.
hemoglobin जहाँ पर उसकी जरूरत है वहां पे आपको देना है.
देना ही है, जहाँ जरूरत है hemoglobin वहाँ देना ही है.
Thank you so much, sir. And I think this is a basic question. And next question, I think MRP wise, MRP just to inform you, 715 rupees. We are going.
जी.
But
Otherwise,
just I want to say that if patient gets a dose, there is only 21,000 rupees to the patient in 3 doses. When compared to 5 doses, there is a patient also able to pay 90 rupees per dose, multiply to 5 doses. Just nearby 2,000 rupees also comes to the patient. So there is studies that patient not required to wait the whole month, get vaccinated within a week, and there is a very less transmission.
correct. That's true. That's true.
Thank you so much, sir. I think there is no question, no more question in box.
Thank you so much.
Thank you so much, Doctor. And I would just like to thank you so much, Dr. Asumita, sir, for your informative and wonderful talk about anti-rabies vaccine. And we are launching rabies as you will explain and in simple way and wonderfully. We truly appreciate your effort. Last but not least, we would like to inform you that Travis has won two prestigious awards in innovation category. First is Economic Times India Pharma Award, and the second is Golden Globe Tiger Award, which Travis won the two awards, sir, internationally. So, all about this is all about from my side. So, thank you all participants and all doctors, all delegates. So, for your valuable time. And any other query, we will also you can ask any time from me, either from my colleagues here, Pawan Kumar Chope, Saurabh Tiwari, Vivek Singh, and Jiten Chauhan, Vivek Pandey. Here also we have the colleagues in Varanasi, and in Jaunpur headquarters also we have Ankit Tiwari. So you can ask any time any query about Thravis anti-rabies vaccine. We have the world first novel anti-rabies vaccine, 3-dose anti-rabies vaccine, Thravis. 3 dose, 1, 2, 3, rabies free. Thank you so much, Dr. Sir. Thank you so much, sir. Thanks.
Thank you so much. Thank you.
We can close, sir. If there is no question. Thank you so much.
Okay, sir. Can we end this meeting now?